Welcome to Nirmaya Care, where health meets understanding. This video was originally published on nirmayacare.com. For an uncensored, ad-free version of this video and other health education content, visit nirmayacare.com.
Let's talk about urinary tract infections, or UTIs. They are incredibly common, but wow, are they surrounded by a ton of myths and confusion. So today, we're going to get the real story. You know that feeling? It often starts out really subtle, right? Just a nagging discomfort in your abdomen. Maybe you feel like you have to run to the restroom more than usual, or you get that unmistakable, awful burning sensation. It's so easy to just ignore it and hope it'll go away on its own. But this is a huge deal. Look at this number. The National Institutes of Health says that up to 60% of women will get a UTI in their lifetime. That's just a massive number, making it one of the most common infections out there, period. And yeah, while we hear about UTIs being way more common in women, it's so important to remember this is not just a women's issue, not at all. Men absolutely get them too, and the symptoms can be just as disruptive. So understanding the causes, that's crucial for everyone.
Okay, so to really get a grip on what goes wrong when you get a UTI, we first have to understand how things are supposed to work. Let's start with the basics. What exactly is the urinary tract?
Think of your urinary tract as your body's own amazing, super efficient filtration system. It's a pretty elegant setup, really. First, your kidneys produce urine to filter out all the waste. Then, the ureters, these little tubes, transport that urine down to the bladder, which is basically a storage tank. And finally, the urethra is the exit route. Simple, clean, and most of the time, it works like a charm.
So, a UTI happens when you get some unwanted guests. We're talking bacteria, usually E. coli, crashing the party. They find their way into this normally sterile system, and they can set up an infection literally anywhere along that path, from the urethra all the way up to your kidneys. Okay, so this brings up a really important question. Who's most at risk? And honestly, the answer might surprise you because the risk factor, it actually changes dramatically over a person's lifetime.
This is where it gets really interesting. The risk totally flips depending on your age. In the first year of life, it's actually baby boys who are at a higher risk, and that's often because of congenital anomalies, things they're born with. But then, from age 1 to about 50, the tables turn completely. Women become way more susceptible, and that's mostly because a shorter urethra is basically an easier, shorter runway for bacteria. Then after 50, the risk swings right back, and men become more likely to get a UTI, often because an enlarged prostate can block the flow of urine. And it's not just about age and gender. There's a whole bunch of other things that can up your risk. For example, frequent sexual activity can introduce bacteria. Certain kinds of birth control like spermicides can be a factor, and so can medical conditions like diabetes. Even just a simple habit like holding your urine for too long can create that perfect storm for an infection to take hold.
Okay, so we've covered what a UTI is and who's most at risk. Now, how do you actually know if you have one? Being able to recognize the symptoms early, that is absolutely key.
And listen, it's not always just that classic burning feeling. It can be pain in your abdomen or your pelvic area, or that feeling like you have to go to the bathroom all the time. You might even notice your urine has a strange smell, or yikes, even see blood in it. And if that infection starts to spread, you could get a fever, chills, even feel nauseous. These are all serious signals from your body, and you really shouldn't ignore them. All right, now it's time for one of my favorite parts of any explainer. We are going myth-busting. There is so much bad information floating around about UTIs, so let's just bust some of the biggest myths one by one. Ready? Okay, myth number 1. Are UTIs a type of STI? The answer is a clear and simple no. Now, sexual activity can increase your risk. It can physically push bacteria closer to the urethra, but you don't catch a UTI from a partner like you would an STI. The bacteria causing the problem, it's typically your own, just in the wrong neighborhood. Now, this next myth is a really dangerous one. The idea that a UTI will just fade away on its own. Let me be clear, it won't. If you don't get proper medical treatment, a simple bladder infection can travel all the way up to your kidneys, and trust me, that becomes a much, much more serious health problem. And of course, we have to talk about the famous cranberry juice myth. Will it cure a UTI? Here's the deal. Some evidence suggests it can be helpful for prevention. It might help stop bacteria from sticking to the bladder wall in the first place.
But, and this is a big but, once you have an active infection, chugging cranberry juice is not a substitute for antibiotics. It's just not a cure.
Okay, myths busted. So now let's get practical. Let's talk about what you can actually do to take control, focusing on prevention and making sure you get the right care if you need it. The good news is there are some really clear, simple steps you can take. Number 1, stay hydrated. Drinking plenty of water, like 2 to 3 liters a day, literally helps flush bacteria out. Also, make sure you're urinating frequently. Don't hold it in. And it's especially crucial to go after any sexual activity. And of course, just simple things like good intimate hygiene and avoiding irritating perfumed soaps can make a huge difference.
But here's the most important piece of advice. If you have symptoms, you need to see a doctor. Period. And if they prescribe you antibiotics, you have to finish the entire course, even if you start feeling better halfway through. Stopping early is exactly how we end up with antibiotic-resistant bacteria, and that just makes future infections way harder to treat.
And this, right here, is maybe the single most important takeaway from all of this. Please do not feel ashamed or embarrassed to talk about it. A UTI is a medical condition, plain and simple. It's not a reflection on you. Being open and honest with your doctor is the absolute fastest way to get the right diagnosis and get on the road to recovery. So, as we wrap things up today, I really want to leave you with this question to think about. Now that you know the facts, now that you're armed with the real story, what's one small change you can make, starting today, to protect your health? Maybe it's just committing to drinking 1 more glass of water a day. Or maybe it's finally making that doctor's appointment you've been putting off. Whatever it is, remember that every small step really, truly counts.